You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today joins me from MacKillop Family Services. She is the Carer Recruitment and Development Officer. Our guest today is Jasmine Perry. Jasmine, welcome to the show.
Hi, Wayne.
Now, Jasmine, tell us a little bit, first of all, about MacKillop Family Services, and then about what you do.
Sure. Well, MacKillop is a values-based organisation. We're driven by social justice, and we have a long legacy of helping, people within our community who are typically vulnerable or in need of some assistance and support. We're often recognised for going above and beyond and supporting marginalised children, young people and families.
Okay, and my assumption from the name is that it's associated with the Catholic Church?
That's right, yes.
Okay. Now, you're the Carer Recruitment and Development Officer at MacKillop Family Services. Tell us about your role there.
So my role is overseeing all of our recruitment activities. So a lot of that is marketing and attraction of foster care, whilst also sort of bringing new foster carers into the sector or into the system. We want to support and retain the current foster carers that we have. So I oversee and support our care recruitment staff to support and train and retain our foster carers.
Now, often what we hear in the media about foster care is negative. What do you think the biggest misconceptions about foster care are?
For me, it's probably more around, the children who are coming into care, that always, that these children will be challenging or, difficult to support, when in actual fact that's not the case. A lot of the children that we do have coming into care really, are looking for a stable, safe, loving home environment. And that may be for a short period of time where we are supporting the family to be able to reunify them with their children. But then oftentimes, children may have to remain in care for a little bit longer. And we also have foster carers who will, sort of have long-term care of children up until they're 18.
And what are the characteristics of a foster carer or a potential foster carer? If you're walking down the street, can you pick them out?
No, not really, because I guess there's, anyone can be a foster carer. I guess, what we're looking for are people who, have an ability to see that there is a need within their community, to be non-judgmental, to be able to support someone else's children within their own home, and that may be with their own family. They may have children of their own. Mm-hmm. Oftentimes we hear people say, I couldn't be a foster carer because I don't own my own home, or I've never parented before, when in actual fact they're just myths. Anyone can be a foster carer from any background. So it is really hard to pinpoint. We often see that carers are typically, sort of 30 to 45, 50 when they're coming in, and then, people can do that for the rest of their lives.
And Jasmine, what's the footprint of the MacKillop Family Services geographically? Are you Australia-wide or are you restricted? You are? Okay.
No, so sorry. We're in New South Wales, Victoria and Western Australia. Right. And within those three states, we have a range of services. So we have things like family support services. They include family violence programs, parenting support, early intervention services, education services for young people who cannot engage in mainstream schooling. We also have disability services and programs to promote social inclusion, and then our out-of-home care services, and that's primarily where my focus is on foster care when young people can't live at home with their family.
Jasmine, we've been talking on air lately a lot about the impact of the internet on business generally and on health services, triggered largely because Amazon announced their arrival in Australia. In your role, do you use the internet and social media?
Yeah, definitely. So, I mean, for us, it's mainly around the recruitment of foster care. We use both Google and social media. they have a huge impact on our ability to recruit new foster carers. Google is definitely one of our top channels. And oftentimes, in the areas where we work, there's multiple services, there's multiple agencies who provide foster care. More specifically in Victoria, there's, over 30 foster care agencies. And people will generally search for foster care. They might not know who MacKillop is. So it's a general sort of search for the foster care and then your local suburb or your city or something like that.
That's been a big change, I guess, over the last 20 years. It's got to be a pretty cost-effective way to communicate with your potential audience, I would think.
Absolutely. And, we're a non-for-profit organisation, so we do have to find cost-effective ways of, promoting our services. And definitely Google and social media help us to do that. Like our Facebook page is probably... we have we've got 7,500 followers on Facebook. And, the audience that we target on Facebook, again, is your 35 to 45-year-old females, because they're the audience that are most receptive to the message, of foster care and the stories that we share about children and young people. So, and we can also promote other content that we have from our agency, our blog posts and, feel-good stories and things like that, without sort of necessarily having a direct call to action.
Yeah, well, I was interested in talking to you about call to action because I'm hoping that some of the people that are listening to us today have gone, I'd like to know more about that. How can people reach out to you, Jasmine? Yeah,
so we have our MacKillop website. It's macKillop.org.au/foster care. We also have a foster care hotline. So to give us a call, a lot of people generally just want to find out some information to start with before they decide to become a foster carer. We understand that it's a long process in making that decision. So we have people here who can sort of talk you through it and help you better understand what foster care is. And that number is 1300 791 677. And, we're always here to answer questions. Jasmine, it's been lovely having a chat with you today. Thank you for making yourself available. No worries. Thanks for having me. If you've just missed my chat with Jasmine Perry, Carer Recruitment and Development Officer at MacKillop Family Services, the good news is on our website you can find a transcript, and in that transcript the website and phone number if you missed it. You can also listen to the audio archive on SoundCloud, YouTube and iTunes. You're listening to Health Professional Radio. My name is Wayne Bucklar.